Dr. Partha Borah. I'm a consultant pediatrician at Pratiksha Hospital, Guwahati. So as a part of World Health Day celebration, which we are celebrating on 7th of April this month, we are doing a small program to give you information related to baby care. This year theme is Healthy Beginning and Hopeful Future, and this year we'll be concentrating more on the mother and child care. When we talk about milestones, actually, there are a few things that we need to look at. We need to look at the baby's social development, the motor development, and as well as the fine motor, and as well as his physical growth, when we grossly talk about. In gross development, when we talk about his health, as in wise, his weight gain, his head circumference growth, whether the child is growing in his length. All these things will implicate whether the child is healthy or is suffering from any diseases. When it comes to the neurological developmental milestones, there are 4 major milestones that we need to talk about always. We need to emphasize that all these babies, they achieve these milestones in time. The most important ones are like the baby should have social smile, that the baby should, whenever the baby has an eye-to-eye contact with his parents, he should smile back, and that should be by 2 months of age. The baby should be able to hold his head straight by 4 months of age. Baby should be able to sit its back straight by 8 months, and by 9 months a child should be able to stand with support. Similarly, there are other milestones like grabbing things, taking one from one hand to another, and then of course the most other milestone is the language development, which we started to see from 9 months of age, and at 9 months we also see that the child responding to the name call, which also gives an information that whether the hearing is normal or not in the children. See, exclusive breastfeeding is a gold standard for baby care. So all babies who are born should be exclusively breastfed for first 6 months of age. Why? Because see, the milk is always species specific when we say. So human milk is also specific to its baby. So whenever a baby is born, we should always encourage the parents or the mother so that the mother continues to exclusively breastfeed for first 6 months of age. Exclusive breastfeeding provides not only nutrition, it is providing immunity to the child. In fact, the first immunity, the first milk that comes out of the mother's breast is the colostrum, and that provides the first immunity to the child, and then it prevents the child from getting infections, 2 dreaded infections that we are most worried about in the first 1 year of life, pneumonia and diarrhea. These 2 dreaded diseases can be taken care of or be prevented if we exclusively breastfeed the baby for the first 6 months of age. Similarly, certain problems which can occur in the later part of life, like the allergic diseases. Now there are widespread studies which have shown that babies who are on exclusive breastfeeding for the first 6 months of age, their tendency to develop allergic diseases in the future is very less compared to the other children. When it comes to intelligence, now there are studies which have proven that the children who are exclusively breastfed for the first 6 months of life, their IQ quotient, when you compare with the other babies who are not exclusively breastfed, their IQ is 10% more compared to the other children. The most common infections the child suffers in the first 2 years of life are the viral infections. So to prevent viral infections, of course the most important thing is the exclusive breastfeeding in children, which we have already discussed. Apart from that, we need to think about vaccinations. Vaccination also prevents the seasonal influenza infection that occurs in children. Now, post-COVID, we have seen a lot of other viruses has also come into play, and these are creating an havoc. Especially a few months ago, if you have seen the news, we have seen an influenza outbreak in northern India. We have seen similar outbreaks of influenza, measles outbreak in the US. We have heard about the mumps outbreak in northeastern state of part of India, and also in other parts of the country. So there are seasonal outbreaks of certain viruses which keeps occurring. So prevent them with, of course, 3 things actually. One is nutrition. Nutrition includes exclusive breastfeeding, good balanced diet for the children, vaccination is very important, and of course maintaining a good personal hygiene in children, which is very important, which we used to practice during the COVID era. one subject where we hardly discuss about the importance of sleep, especially in children babies who are less than 2 years of age, especially in infants. See, when you talk about sleep, why is sleep so important? Actually, sleep is a time when there is maximum brain development occurring in the brain. And we have phases of sleep. We call them as the NREM sleep, the REM sleep. In the REM sleep, there are two importance actually. This is the REM sleep where the maximum, the hormones which are required for brain development take place. And this is the period when maximum brain growth occurs. For example, you must have seen babies, newborn babies smiling during their sleep. Actually, this is the period when they are in REM sleep, and this is the period when there is maximum brain growth occurring. So at that moment, you should not disturb the baby. Secondly, important thing is that during the REM sleep, the memory consolidation starts occurring. So babies who sleep longer and who takes a proper nap, that is for infants we say that they should sleep for at least 10 to 11 hours in a day. And if they have an uninterrupted sleep for 10 to 11 hours, this is the period when they will have maximum brain growth occurring. And moreover, with a good sleep, the immune system also improves. When the immune system improves, they will again have a less chances of getting frequent infections. See, gas is basically a misnomer. Why do babies get gas? Actually, there are three things that can cause gas in the stomach of a baby. One is most important is swallowed air. The swallowed air could be two things. If the baby is on breastfeeding, when he's sucking and swallowing, he's swallowing air along with the milk. If the baby is bottle fed, the baby gets swallow a lot of air along with the milk from the bottle, which we call as aerophagia. And third, suppose the baby's nose is blocked and baby is breathing with his mouth open, the baby swallows a lot of air. And the milk which the baby eats contains lactose. When it gets digested in the tummy, again it produces some amount of gas. Now these are the reasons why baby develop gas. It is not because of any indigestion in the baby. Because baby is eating the best food that the mother provides. This is not providing any unnecessary food or unhealthy food to the baby. So the question of indigestion usually doesn't occur. Secondly, how do you identify? See, most important thing is that the babies cry. Babies cry is like a language. So whenever a baby cries, he's trying to express something. And if you can concentrate on his cry, you'll see that every cry in the baby is different. His hunger cry is different. When he poops or he pees, his cry is different. When his tummy hurts, his cry is different. Usually we call it a colicky cry. And colicky cry usually occurs in a particular part of a day. We call it as 3-3-3. It usually occurs for 3 hours in a day. Usually it occurs in the evening, which is called as evening colic. And there's a typical pattern of cry. The baby usually shrugs his shoulder and the legs into his tummy. And then he keeps crying, he howls, and then he stops. Again he cries and then he relaxes. Again he cries and then he relaxes. He tries to climb up on the mother's chest. All these things, if you see, that means the baby is having colic. See, what I keep telling to my parents is that baby care this is the first time you have become parents. So this is the time to enjoy, to relax. You should not get stressed after your baby birth. And there should not be a lot of expectations. And what I keep telling is don't follow a typical copybook style of parenting. Always follow your basic instincts. You should try to imbibe your own instincts. You should try to understand your own baby and try to find out what is the reason. If he's crying, what is the reason for his cry? Is he crying because of hunger? Is he crying because he needs something? Comfort is more important. The child is not comfortable in his room. He needs to be carried. All these things the child can cry. Then again, with nutrition, most of the time we see mothers very concerned about the weight gain of a baby. Then if the baby is not gaining weight, suppose, then why is the baby not gaining weight? Is the baby not fed properly? Is he suffering from any infections like any urinary tract infections? Does he have any other illness that is causing the problem? So we need to find out, and we need to enjoy parenting. Parenting is something, or parenthood is something that we need to enjoy. I think you should keep away you should be keeping away yourself from all the WhatsApp groups and the parent groups where you will be poked with a lot of questions and a lot of advices, unnecessary advices at many times. And this actually, I've seen parents coming up with a lot of stress, and Googling is another thing that causes a lot of stress in parents. So whenever you have a problem, you should come to your doctor, you should discuss with your doctor, and if there is any problem, that can be sorted out, and then your stress you can be stress free.